Palestinians in Gaza are facing another day of bombardment. Israeli attacks have now killed more than 45,000 people since the war began in October last year. In Deir el-Balah, in central Gaza, yet another school sheltering displaced Palestinians was hit, killing 6 people. Rescuers are searching the rubble for survivors. It's the barely functioning Kamal Adwan Hospital in the besieged north, though, that has faced the brunt of these latest attacks. Patients suffering from chronic conditions in the hospital's hallways, in fear of more Israeli strikes, and with very few doctors to treat them. While the army surrounds the facility with drones and tanks, its director has made an urgent appeal.
We are being directly attacked. The ICU unit, along with the maternity and nursing departments, is coming under fire. The bombing is being conducted with tank fire and quadcopters, directly targeting us while we are present inside the hospital departments. We had asked the world to intervene immediately and protect the healthcare system from this brutal attack.
Okay, let's bring in Rachael Cummings. She's the Humanitarian Director for Save the Children International. You're joining us from Deir el-Balah as well, inside the Gaza Strip. It's been a few weeks since you were able to come on to Al Jazeera, I believe. If I'm right about this, you left Gaza and came back. And I was wondering just if you've seen any changes since you were last there.
Yeah, good morning, and thanks for this opportunity. You know, the situation in Gaza and where I am in Deir el-Balah continues to deteriorate extraordinarily so. We now have the winter upon us with rains and very, very bitterly cold weather. And what we know and what we see and what we hear from children and their families is that they are so ill-equipped for this weather. It's bitterly cold. It's very, very difficult for children and families to remain with any dignity in this context. We have open sewage still remaining in the streets, mixed with the rain and the mud. It's very, very difficult to maintain any degree of hygiene, sanitation, and of course, dignity. The food and access to food and clean water remains extremely challenging for children and their families. So, if anything, the situation in Gaza extraordinarily continues to deteriorate.
What about northern Gaza? Because we know that is, even by Gaza's standards, which are horrific, northern Gaza is worse yet. And I believe there are still children in northern Gaza, which has been under siege, as we were saying with Hani there, for 70 days.
Yeah, the situation in the north is deeply concerning. Save the Children is not yet operational in northern Gaza. However, we are working with partners there to develop some support for children. But the reports coming out, the same reports that others will have seen from OCHA and other partners, are very, very concerning for children and their families in Jabalia and other areas of northern Gaza.
Stand by for a second, because I want to share a few numbers with our viewers. Gaza is the most dangerous place in the world to be a child. That's according to UNICEF, the UN's agency for children. The UN agency has described the situation in the Strip as, quote, hell on earth. One child is killed or injured every 10 minutes. Thousands have had one or both limbs amputated. UNICEF says nearly all 1.1 million children in Gaza are in urgent need of protection and mental health support. And it estimates at least 19,000 children have been orphaned since the war began. Rachael, what is it? I mean, are we able to estimate or assess what the impact, the lifelong impact of this is going to be on children who are going through this war right now?
I mean, excellent question, because of course we know that over 1 million children are impacted. The whole population of Gaza is impacted by this war, and the immediate, medium and longer term impact on children's mental health is unknown. We know that we are seeing children in our clinics, children in our child-friendly spaces for child protection and case management, and in the learning spaces that we support and run. We are seeing children deeply, deeply affected currently by this onslaught and this war that has been going on for 12 months. But the medium and longer term impact is terrifying, actually, for the whole population of Gaza. What we do as Save the Children and with our partners is to provide immediate alleviation of the suffering, but we know that what we're doing is really a drop in the ocean. We're scratching the surface in terms of being able to meet the needs of the whole population of children in Gaza. It's really desperate for children here.
So there are children, as we know, in hospital. I mean, there are men, women, elderly, and children in hospital. For those who need the kind of care they can no longer get in the barely functioning hospitals of the Gaza Strip, is there a window for them to be taken out of the Strip and get medical care that they need or not?
Save the Children isn't involved in the medical evacuation of children or adults from Gaza to other countries. That's facilitated by WHO in collaboration with the Ministry of Health. But we know that there's thousands of children with chronic conditions as well as acute needs that desperately need a higher level of medical care.
Okay, just before I let you go, if we don't speak to you again while you're in Gaza, what would you want people watching to know about what you're seeing there?
The situation is desperate. Every day seems to get worse and worse for children. And we are not, as a humanitarian agency, able to scale up and able to meet the needs of children in this very complex and dynamic war. We need a definitive ceasefire. We need the world to stop bombing children in Gaza, and we need safe passage and access to populations who are in desperate need of humanitarian assistance.
All right, Rachael Cummings, Humanitarian Director for Save the Children International. Thank you very much.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.